Hi, I'm Tsai, Executive Partner at Syncona.
My name is Roel Bulthuis. I'm a Managing Partner and Head of Investments at Syncona.
I've been in the pharmaceutical industry for 25 years. Started my career at Pfizer and then went to Bristol Myers Squibb, where I worked in a number of areas, including the cardiovascular area, in the oncology area, became the head of late phase development, and then moved to Amgen, where I was the chief medical officer at Amgen. And then my job before joining Syncona was the chief medical officer and head of global drug development at Novartis, where I was there for almost 5 years before joining Syncona.
I joined here in April from a background of being an investor and deal maker in the healthcare field for the last 20 years. That happened in my case after my professor and I looked each other in the eyes and concluded that I was never going to win a Nobel Prize. So I had to find a different destiny, and so I had a great experience in the last 15 years as a venture investor. The last 5 years was intriguing because it was investing in a portfolio that was a mix of healthcare and tech companies, where I think you cross over between sectors that can benefit from the learnings of each other. And the 10 years before that, building a corporate venture fund from scratch as part of a large pharma company, where you benefit from the side of the venture investment perspective on healthcare, but also have the big pharma perspective on the products that you develop.
As I was thinking about the next step in my career, I was thinking about a number of different criteria. And one of the leading criteria was being involved in breakthrough technologies. And I know that Syncona is involved in a number of those, including cell therapies, gene therapies, as well as monoclonal antibodies and different modalities, obviously. Second is really taking ideas from academic institutions and making them biotechs. I think this is such a difficult concept. Sounds very easy on paper, but it's really difficult to take an idea from scratch and then developing that. And actually, eventually, the eventual goal is to make this into a drug so that people can receive it to improve their lives. And third is really working with fun people. I had a chance to interview and meet a number of individuals on the team, and they were just really down-to-earth people who I think that I would enjoy going out, and whether it's having a coffee or a drink with. And it's been that way since I've been here. It's a great team to work with, and it's actually fulfilled all of my expectations so far.
There's not many investment firms where strategies match the asset cycle in healthcare. It's incredibly difficult given the long cycles of product development and the high risks that you encounter in therapeutics development to tailor an investment strategy to that. And I think if there's one thing that this Syncona strategy has done really well is to have a level of ambition, tenacity, and the ability to stick to companies that allow you to fund programs all the way from an academic idea to what we get now, preparing for product approvals and preparing for product launches. And so what attracted me there is that, and I've been an investor in the field for the last 15 years, I've seen how Syncona has transformed the way that we think about healthcare investing in Europe. And so the opportunity to join a team and help the team to scale the business at a moment in time where we are, in my mind, at a significant value inflection point. We've had our first 11 years. We've created a portfolio with great assets in it. We have significant data points coming in that portfolio. We also have significant cash. And while we're in a very difficult market right now, I think the firm is in a great position to execute on strategy. So for me, the opportunity was, can I contribute to and can I help the team to scale the business from what I think were a very successful first 11 years.
So given the experience that I have in terms of developing drugs, working with teams at Syncona, as well as the portfolio companies, working with the individuals at the portfolio companies to ensure that execution is flawless. One of the exciting things about being at Syncona is really seeing the breakthrough technologies. I had a chance to look through the entire portfolio, whether that's in the cell therapy space, whether that's in the gene therapy space, and across different therapeutic areas in oncology, cardiovascular, immunology. When I looked at the entire portfolio, one of the companies that really stood out was Forcefield. As most people probably know, #1 killer around the world is heart disease. And in the area of heart disease, there's been a number of failures. I saw a differentiated approach in the science that was really outstanding in Forcefield, which is treating patients in the area of acute myocardial infarction or acute heart attacks. And I think having a breakthrough in this area would really transform just the lives of many patients. And given the science as well as the unmet need, I decided to take a role on Forcefield and then eventually taking on the CEO role most recently at Forcefield.
So since joining Syncona, I've been on the road a lot, and it's really important for us to get our message out that we're open for business. It's a difficult market to finance, but we have a great portfolio, and many of our companies are out there to finance. We're looking for like-minded investors to come along for the ride with us, and we're actively looking for new deals, because we do feel that we are in a great position to do new investments in this market. And whether they are company builds or assets that we find in the market, they all fit into a strategy that we have to further accelerate the build of our late clinical stage portfolio. I think in my mind the firm has been incredible at picking science historically, and the ideas that you see across our portfolio in many cases are ideas that came from brilliant scientists at universities but complemented by insights from the Syncona team. If you add investor discipline to that, if you add a little sprinkle of we need to focus on outcomes, I think we can be an incredible team. And if you think about the position that we're currently in, strong portfolio, mature clinical stage companies, and a healthy cash balance, I'm convinced that we can finance our way out of this cycle and come out of it as a stronger firm.